Would you like to just give me your name and your role within G4S?
Yes, I'm Tina Easton. I'm HR Director for Integrated Services, which is a business unit within G4S UK and Ireland. And we provide facility management services to a whole range of different industries, public sector authorities and organisations. Excellent.
Now, what made you decide to support today's event?
Well, as Zoetta, as you know, you approached us. We were very, very keen to extend our agenda in diversity and inclusion. In particular, we've been doing a lot of work with BME, in particular in the communities, and focusing on our communities, both in terms of our client communities, but internal communities, and trying to raise our profile and our workforce engagement in that area. Basically, when you contacted us and explained what you did as a network, we felt that this was something that was an excellent opportunity for us to engage in, and that's why we're here today.
Excellent, thank you. Now, how do you feel today's event fits in with G4S's Equality and Diversity and Inclusion programme?
Well, I think it's quite important to recognise that we're very big. Obviously, G4S is a huge global organisation, and in UK and Ireland we have a very large presence. We're very diverse in ourselves. Our business units are very different. So for us, we all have separate diversity and inclusion strategies that fall within our overall diversity and inclusion policy and strategy. And it's very important to us that we look at how diversity fits into the workplace and the communities that we operate in. And in fact, one of the really exciting things that we're very proud of is where we can get it to work very, very well. Everybody becomes one team and part of the total end-to-end healthcare solution. And I think trying to harness that and to create that community that extends therefore out into the external communities that we work with is powerful. And only last week I was visiting a hospital in the north of England where it was very exciting to see cleaners and ward staff actually totally working as one team with patients and visitors and offering that one care solution. So this is about really extending those themes. I thought Desmond Tutu's fantastic, and the Tutu Foundation's fantastic focus on humanity and the whole piece about valuing everybody as part of what they bring to that team and that solution and all skills was really exciting, and it meant something to me as HR Director. I can see that that's something we want to get right and extend, so that we work with NHS trusts and we're a complete partner with them, and it can work, and it's very powerful when it happens.
Thank you, that's excellent. Now, moving forward, how will you continue your relationship with the Health and Social Care BME network?
Well, I'm really excited today because I think the challenging conversations for the Tutu Foundation is quite different. And I quite like the idea of bringing in a different type of organisation and a different type of interaction with our workforce. We do something called Pride, which is first line training for all of our supervisory managers, which is protect, respect, involve, develop and engage. And that includes an enormous amount of cultural awareness and diversity, inclusion, also looking at disability, all aspects of people. And I think this is one step further. This is about really trying to raise awareness and understanding how teams can operate. So I'm hoping that we can work together in the future and look at how we can bring that network into our workplace and hopefully give you something back as well.
Excellent. Thank you very much, Tina.
Thank you.